Hello, this is Father Simeon again, and this is part 2 of our two-part episode on the wisdom of Sirach in the Old Testament. And it is from chapter 38. We will begin with verse 12. And keep in touch with your physician, for the Lord created him, and do not let him leave you, for you need him. Remember this first part, and keep in touch with your physician, for the Lord created him, is very close to the beginning of this chapter. Honor the physician with the honor due him, and also according to your need of him, for the Lord created him. This reminds us that we're dealing with someone who is a fellow human being in the image and likeness of God like us, and someone who has been given a skill, a knowledge, and abilities, and this is for our benefit. And we give thanks to God for this person and for the gift that this person has received, that the person can heal us. The individual who is the physician can heal us. So we remember here that we should keep in touch with our physician and do not let him leave us, right? We need him. We maintain that relationship. The same is true spiritually with the priest, right? Keep in touch with your priest. Let the priest get to know you. The more the physician, on a spiritual level, on a physical level, gets to know you and your medical problems, then the more the person can correctly diagnose and treat what specifically ails you and give you guidance. So maintain that relationship with your physician. There is a time when success is also in their hands, for they will pray to the Lord to give them success in bringing relief and healing for the sake of preserving your life. So the physician's job is not only to treat according to medical science and to care with compassion, but to pray. A physician should pray for himself that he is a person who's an instrument for God's grace to work through, that God may touch the patient with not only the medical skill that may be applied correctly and with wisdom and with accuracy, but also through this prayer that the grace, the uncreated energy of God, God's presence, will work through the physician and the action of the physician, that the healing that occurs through the physician may be beyond medical science. That is the prayer. It's for a complete healing. And the healing also that it may not only heal the body, mend the body, but that the physician can be part of the healing of the soul through his work. So really the patient should pray for the physician, and the physician should be in prayer for themselves and for the patient, that the patient will be healed. And sometimes what the patient receives medically will be successful, and sometimes it is not. And we don't always know why. Sometimes we ask why, but even if an answer is given, will we accept it? We don't always know. Why do we get sick? Sometimes we get sick because we just live in a fallen world that's full of sickness and death. Of course we're going to get sick. There's sickness everywhere. We're going to catch something from somebody. Or our bodies really don't work properly in this world that is afflicted by death because of sin. That's why we need medicine. If the world is broken, sin broke the world, and we now live in this realm. And this reminds me also from the Gospel of John, chapter 9. Now, as Jesus passed by, he saw a man who was blind from birth, and his disciples asked him, saying, Rabbi, who sinned, this man or his parents, that he was born blind? Jesus answered, neither this man nor his parents sinned, but that the works of God should be revealed in him. I must work the works of him who sent me While it is day, the night is coming when no one can work. As long as I am in the world, I am the light of the world. So we see that we don't always do something that causes us to be sick. In this case, the man's sickness glorified God because through the healing, Christ showed what he came to do for the soul, and that is to enlighten the soul, that those of us who are blind in our hearts, spiritually blind, may see, and that we may be raised up not only physically, but in our souls, that it may be healed. Ultimately, in resurrection, right, which is we're not disembodied souls at the end. We are spiritualized bodies that are physical and that are spiritual, that cannot be touched by death. That is the end for us in resurrection. So we don't always know why success happens. We don't know why we get sick, and we don't always know why sometimes treatment works and sometimes it doesn't. But we trust in God. We don't trust that God exists, but we trust in God. We trust in God as the one who is love and who understands everything infinitely more than we do. We don't know everything. God knows everything. And we know that he loves, and we know that he cares. And this is why he came, in order to destroy death, so that we can live forever, healed in body and in soul, complete. And the very last part of this, he who sins before the one who made him, may he fall into the hands of a physician. Sometimes, since we are psychosomatic beings, soul and body, our sin not only produces a self-inflicted wound on the soul and spiritual sickness and an increased experience of death, and pushes us away from a greater experience of life, but sometimes it does lead us to physical pain, psychological pain, into depression and despair, and maybe even into other physical sicknesses. But a physician is not there to judge something that we've done wrong to make us sick. The physician is there to heal us. And may a loving, prayerful physician mend our bodies, even if we get to that place of sickness because we've done something that we shouldn't have done. The same is true when we go to the church for healing. When we go for confession and repentance, the priest is not there to judge. The priest is there as a fellow human being in order to restore and to heal. And we know from the life of St. Mary of Egypt, we can fall deeply into spiritual sickness, but we can also, by God's power, if we humble ourselves and we seek repentance to change our lives, we can be raised to spiritual wellness, to a degree that's beyond what we can achieve on our own in this life. It's the work of God to transfigure us and to take us beyond what we can do by ourselves. So let's remember what we read here today. This is about the physician and the patient relationship. It is analogous to the spiritual life in many ways. But if you are a physician, care for your patients as best you can through the skills that you have. Be attentive and caring. If you're in healthcare generally, do the same, but do it prayerfully. Bring your practice of medicine, of healthcare, into your spiritual life, right? Bring that into the church. And then your spiritual life can be expressed through your daily work. And if you're a patient, be kind to your physicians. Give thanks to your physicians and listen to them, that they may keep you on this path of healing. Pray for them as they are engaged in healing you, and give thanks to God for all things, for their work. God bless you.